So we're looking at another concept, that's like an infection that could actually, move from the pelvis to the stomach lining, but of course the lining actually courses through the pelvis too. So this is a lining known as a peritoneum. Okay, it goes into the pelvis too. So there can be inflammation of this peritoneum. All right, and if it is so down, they call it the pelvic peritonitis. Okay, if it is so up, they call it the abdominal peritonitis. Do you understand? So pelvic peritonitis is just a infection of the peritoneum. So of course the peritoneum is the lining. This lining goes around the abdomen, also down to the pelvis. Okay, so it's actually a localized form of peritonitis. Okay, so it's usually affecting the lower side, let's say from here down. Do you understand? It's not really like the general peritonitis. So causes, so it's issues related to the reproductive system. Okay, so pelvic inflammatory disease caused from infections from Chlamydia, trachomatis, Neisseria, gonorrhoeae, ruptured ovarian cysts, postpartum infections, perforation of pelvic organs. Then sometimes it's complications from surgery. Okay, so symptoms, since it's occurring so down, you're having pain on the downside. Okay, fever and chills, as if the infection is getting into the bloodstream, nausea and vomiting. Okay, abdominal tenderness or rigidity, distended abdomen, rapid heartbeats, or low blood pressure. Do you understand? So if you want to diagnose all those type of things, you have to actually pick up the pain by doing all those pelvic examination, blood tests to identify the infection and inflammation. Then you can image just to locate the abscess or ruptures, peritoneal fluid analysis and all of that. So treatments, you can hospitalize a person, broad spectrum antibiotics to control infection. Then sometimes if there's abscess or damage to some organs, you have to actually intervene surgically. Then the person is getting dehydrated and all of that. There's pain, dehydration, IV fluids, pain management drugs like corticosteroids.